Hi, this is Dr. Justin here, and today's talk is on skin health and simple things you can do to help improve your skin complexion. So first things first, there's a couple of myths we have to dispel here. The first is, if you walk into any dermatologist office, like I did when I was younger, you would see a little pamphlet dispelling myths in the conventional medicine realm. And one of the myths that were dispelled at the dermatologist's office was that skin health is not affected by the food you eat. And having worked with hundreds of patients with skin issues, and even having fixed my own skin health, that is totally not true. There are foods that actually cause inflammation and are a burden on the detoxification system that do affect your skin health. So first things first, the skin is known as your integumentary system. It is actually the largest organ in your body. And if your detoxification pathways aren't working properly, meaning your kidneys and your liver aren't filtering out toxins properly, your skin will be used to help push toxicity out through it. And we'll see inflammation such as dermatitis, we'll see acne, we'll see whiteheads and blackheads. We'll also see pockmarks, maybe even autoimmune skin issues such as psoriasis or dermatitis or eczema. So again, the skin is a very important means of detoxification. And if we're eating inflammatory diet, eating certain foods that are inflammatory, we're going to drive poor skin health and decrease detoxification. So again, first things first, food affects your skin. Think of your skin as a mirror of your gut. So if you want to see what someone looks like on the insides, look at their skin. That tells you what their outsides indicate what their insides look like. And again, majority, 70 to 80% of your immune system is located on the inside of your body in your intestinal tract. So if you have unhealthy skin, it's a good correlatory indicator that your immune system is probably not functioning too well. So again, first things first, if we're eating grains, if we're eating excessive dairy product, with the exception of grass-fed butter, if we're eating soy or legumes, again, these things are going to cause more inflammation and more production of insulin. Now, insulin is a kind of funny hormone here. It actually helps you gain weight and increase fat. But at the same time, insulin stimulates the sebaceous glands in the skin to produce oil. And this oil then is eaten up by bacteria that create the various inflammation that cause blackheads and skin infections. And that's why things like tetracycline are actually used, because they are antibiotics that kill the bacteria. But again, the issue is, what's the bacteria feeding on to begin with? The bacteria is feeding on the oil being produced by the gland itself. So you don't need to take things like tetracycline that have dangerous side effects like suicide and decrease gut health. We can actually do things that actually stop feeding the bacteria first. So that's the number one thing. Cut out grains, legumes, and dairy out of your diet. Step 2, you may have a parasite, fungus, or bacterial infection. These infections then produce toxins, whether they're mycotoxins or endotoxins, from the excrement of the infections, and your liver, your skin, and your kidneys have to handle that. So if we have an infection, that's the second leading cause. The third leading cause, again, is going to be a female hormone imbalance. We see this with a lot of our female patients, such as low progesterone levels, or we're in a state of what's called estrogen dominance, where we have more estrogen in relation to progesterone, generally speaking. So again, recap, the most common one is inflammatory foods, grain, legumes, and dairy, and excess of insulin. Number 2 is going to be a parasitic, bacterial, or fungal infection. And number 3 is going to be a female hormone imbalance. The first one is the easiest one to address. The second and third one can be addressed with specific lab testing to figure out what imbalance is driving your issue, and then a program can be created to actually help fix that imbalance. I hope this talk was found helpful, and there are a few action items that you can move forward with. For any questions, feel free to email or call the office. Thanks. Have a great day.